I think all new mums go through points of struggle, periods of self-doubt. I think the experience of having a child again in another country, everybody needs a bit of time, a bit of support to get through that period. We've all been there. We've all not slept and not bathed and not eaten. You think you're the only one that's going through it. So to find community after having a baby, it's very important. I have 2 children. One is Coco, who is 4 months old, and I also have a son who is 5 years old. I met my husband in Victoria in British Columbia. We moved to Singapore in December 2023, at the time with 1 child, but obviously now we have 2. I was convinced to come to Singapore because of the educational opportunities. From that perspective, it's been really good. Postnatal depression is, for me, was a period of feeling low, feeling inadequate. In my case, being in a lot of pain and feeling very emotional after giving birth. In the hungry dance. I think because I anticipated this possibly happening again with my second child, I was more proactive about seeking out community and opportunities to connect with other people.
I think being a new mother is very daunting and very overwhelming. There are so many things that are going on in your head. Morning. And also you prioritize your child all the time. So you don't take the time out to do something for yourself. Mama Melodies is a community singing intervention for mums at risk of or experiencing postnatal depression. So the program is a singing program to support the well-being of mums in particular, and that is the focus actually. So that's what differentiates our program from other programs that have mummies and babies. So many of our mums tell us that when they come here, it's a safe space for them. They don't feel judged. I think there's just something innate about us as humans. We love music, we love movement. We actually need to connect with that part of ourselves again, and we don't do that very much in our society nowadays.
Music and Motherhood is a programme of 10 weekly singing classes for mothers who have postnatal depression as a way of supporting their management of symptoms, increasing their bond with their babies, and providing them with a social support network with other mothers. When mothers take part, they experience a greater decrease in symptoms of postnatal depression than when they do either social classes or care as usual with healthcare centres. The project developed initially out of recognition that for mothers who are experiencing postnatal depression, there can be challenges with taking medication, especially when breastfeeding, but Music and Motherhood provides an opportunity for mothers to come together for a non-medical intervention, for a singing programme in communities where they still get to experience those improvements in their symptoms.
You know, sometimes mummies lose themselves in motherhood. They are identified through their babies. Everyone says hi to their babies and not to them. But finding that individual voice is so important.
And I think the moms feel like this is a space where they can like let their guard down a little bit and kind of chill.
And to accept the help.
It just ticked so many of my boxes to find community after having a baby, to connect with locals, to be a part of something I think is so important for your sense of well-being.
I'm so grateful for the experience.
To get out the house every week, sing and make a beautiful noise and connect with other local mums.
Jeg har følt mig så set og forstået, og vigtigst af alt, så har jeg ikke følt mig alene.
The Jameel Arts and Health Lab is a global body that is helping to bring together researchers, practitioners and policymakers to take really promising programmes like Music and Motherhood and scale and adapt them so they can be suitable to impact more mothers, more people globally. I'm working with the World Health Organization and an arts organisation called Breathe Arts Health Research. We were able to tailor and adapt the intervention for different settings, initially across Europe and now globally into Asia and other parts of the world as well. When we're thinking about adapting programmes to other settings, it's really important to consider how experiences of postnatal depression might be different or cultural differences in how mothers sing with their babies. One of the wonderful things about the Music and Motherhood programme is that the songs are actually focused on the mothers, not the babies. So it's not the typical nursery rhymes that we're used to hearing, but it's songs that help mothers to understand and express their own experiences of motherhood. So when we've moved into other countries, we've looked at how we can adapt those songs to reflect local languages, local customs, local religion, local practices.
To have that kind of bonding experience, I feel like she perks up to any time we do sing, but to have songs that I can pull out to sing to her has been really lovely.
Go to see my little child.